Hello, Dr. Anthony Pasek here from the Wellness Connection. Today we're going to talk about autoimmunity and COVID and a maybe surprising connection between those two things. So we see people regularly, almost on a daily basis here today at our clinic that talk about having COVID and getting over it and maybe not quite feeling the same afterward, right? Sometimes we've had people had COVID, more than once, maybe two, maybe three times, but sometimes you just feel like maybe you're not quite back to the baseline where you were before you had COVID, right? That's been called long haul COVID or long COVID, or some people just think of it as chronic fatigue, right? There's new information now that shows that actually might be autoimmunity that's happening. So many of you may have heard of autoimmunity already, but let's talk about what that is to begin with, and we'll come back to the COVID idea. Autoimmunity at its basics is mistaken identity. So what does that mean? Your immune system is supposed to be on the lookout for invaders, right? Like a virus or a bacteria, some kind of infection. Your immune system is supposed to look out for those things that might make us sick, and it's supposed to attack that microbe, that bacteria, that virus, and kill it and destroy it. Your immune system can get confused for a variety of reasons. We'll talk about what some of those things are in just a moment. Your immune system can get confused, and it can turn on your own body part and cause destruction and inflammation of that body part. Depending on what body part gets attacked, what organ, what tissue, you can have a different name for that autoimmune disease. One of the most common ones we see, and it's the most common one that exists, is Hashimoto's disease. Hashimoto's is when your immune system attacks your thyroid gland, and there's other conditions that can happen. When your thyroid is attacked, it could be called Graves' disease as well. We'll talk about that as well in a moment. If your joints are being attacked, that could be rheumatoid arthritis. If your skin is being attacked, that could be eczema or psoriasis. If your pancreas is being attacked, that could be type 1 diabetes. If your brain is being attacked, that could be multiple sclerosis or the nerves in your spine. The list goes on and on. There's ones that aren't really individual body parts or tissues, things like lupus or scleroderma, where there's more general tissues all over the body that are potential for autoimmune attack here. So autoimmunity, it's mistaken identity. Your immune system has become confused. It has turned on body parts that are supposed to be ignored or even protected and defended, but are actually being attacked by your own body. So there are a few things that have to happen for you to develop autoimmunity. I will show a little diagram here that will illustrate this. So at the top, we have a genetic susceptibility. You can't really do anything about that. There may be a genetic tendency in your family toward having autoimmunity. As an individual, you may have a genetic predisposition for certain autoimmune diseases like Hashimoto's or lupus or type 1 diabetes or something like that. But it's not enough. Just to have the genetic susceptibility is not enough. One of the other things that we might see that shows up is increased intestinal permeability to macromolecules. What the heck does that mean? A leaky gut, right? Some kind of barrier breakdown in your gut usually. But what I want to focus on today is this last category, these environmental triggers. There are foods that can trigger autoimmunity. There are chemicals that can trigger autoimmunity, but the big thing we want to talk about today is infections. Things like microbes, and in particular, we'll talk about virus, the COVID virus, SARS-CoV-2, talk about how that can trigger autoimmunity, because this is fairly new body of evidence, a new body of understanding that is a little bit alarming, frankly. Okay, gotta have all these things present. We want to look at what the infectious triggers can be. So, in certain people that have a genetic susceptibility, and then they get an infection with COVID, and in some cases, the protein that gets produced in your body as a result of the vaccine both the infection or natural exposure from infection or the vaccine can have the potential to trigger autoimmunity. There are several ways that that can happen, and those aren't really part of what we need to discuss today, but we want to know what might show up. So there's a list of potential autoimmune diseases that are associated with COVID. I want to pull that list up, okay? So from the top, we see type 1 diabetes. This is where your body does not make insulin any longer. Your immune system attacks your pancreas, so you lose the ability to produce insulin. The second thing we see is Graves' disease, and this is another autoimmune disease to the thyroid. It's not Hashimoto's, but Graves' disease rather is usually an overactive, a hyperthyroid state. Now, we do see patients in this clinic with Graves' disease. It was previously fairly rare. We would see maybe one person a year, maybe every 2 years that had Graves' disease. But now it's maybe every 6 or 8 weeks that I'm talking to somebody as a new patient that is experiencing Graves' disease. The incidence of this seems to be going up. There may be a connection here. The SARS virus can be a potential trigger for Graves' disease here. We see other more rare, not well-known autoimmune diseases that'll be on this list: autoimmune hemolytic anemia, polyneuritis cranialis. This one, however, is a little bit more well-known: postural orthostatic tachycardia syndrome. That is for short known as POTS, P-O-T-S. And the short description of what this is: unexpected lightheadedness. You change position and your heart races and you feel like you're going to faint, like you're lightheaded and dizzy. And this is something that we are also seeing more of recently. Systemic lupus erythematosus, that's also just known as lupus. Sometimes it's called SLE. One of the things that we will talk about, and actually we can talk about this right now, is the antibody that's used to measure, one of the things we use to screen for lupus. It's called anti-nuclear antibody, or ANA. And ANA, about 20, 25 years ago, was only present in maybe 4 to 5% of the population. As of about 2012, that was up to more like 12 to 15%. And the most recent estimate now, not that much longer, not that much later, 10 years down the line, is about 20% of the population, about 1 in every 5 people. And I suspect we're going to see that even continuing to go up, because that anti-nuclear antibody, that ANA, does seem to be one that is very likely triggered by this virus. And lupus is one of these non-specific autoimmune diseases. It doesn't attack a particular body part. There are several different tissues, like your kidneys and your blood vessels and your skin, that can be the target of attack. Anti-Phospholipid Syndrome, and this is something that often manifests during pregnancy. Phospholipids are part of your cell membranes, so every cell in your body has phospholipids in them. Guillain-Barre Syndrome, this is fairly well known to some people. This is controversial in some people's minds. This is a syndrome that's similar to acute paralysis that is often the result. Most people anecdotally have found that would happen after a vaccination. But Guillain-Barre can be triggered by COVID. Rheumatoid arthritis, pretty well known, joint inflammation and destruction. Immune thrombocytic purpura, Miller-Fisher syndrome, Kawasaki disease. Again, these are more obscure. Vasculitis is inflammation of the blood vessels. Now, the interesting thing, some of these things like POTS and vasculitis, even some of these anemias and things like that, can be how the acute illness phase of COVID actually shows up. And there's recent thought now with this information, hey, maybe this is why certain pharmaceuticals that are used to treat autoimmune diseases, like hydroxychloroquine, that's something that's used to treat lupus, for instance, why it may for some people be effective in helping when you have COVID, right? There could be a autoimmune process happening when you're acutely sick with COVID. And for people that never really fully recover, there may actually be an autoimmune long-term component here, okay? So what do we do about this, right? I think the real question is, do we have concern? Do you have concern as an individual if you've had COVID or even have had the vaccine and feel like you have had consequences, things that you never really quite got back to normal, or new symptoms that appeared, or you had symptoms that came on when you had COVID that maybe didn't fully resolve when you thought they should have? This is something that functional medicine can help with, that we can look into. We can screen for some of these conditions. We can test for some of these antibodies and see if this is relative. We do have many patients that have gone on to recover from these type of long COVID symptoms that can get better from this type of approach. Thank you.